My name is Jasprit. I'm a registered nurse, and my research focuses on improving ICD patient education. Implantable cardioverter defibrillator, also known as an ICD, is a cardiac device about this large, surgically placed under your skin right here, just like the image above. The purpose of this device is to stop a life-threatening heart rhythm if it were to occur by shocking the patient's heart. So now imagine for a second that you have agreed to receive an ICD because of its life-saving function. But it's not until after you receive your first shock that you're surprised to learn that your driver's license is suspended for 6 months. Why did nobody warn you? And it's not until after you've had the device for a few weeks that you begin to realize that although the ICD is life-saving in function, it does not help improve your heart symptoms like you thought it would. This shock is the reality for some patients. So you might be wondering, well, how are patients able to receive an ICD but aren't comprehensively educated? Well, the issue is that oftentimes healthcare providers have limited time to discuss ICD education with their patients. This leaves patients with unmet information needs, misconceptions, and feeling dissatisfied. Altogether, this can fuel anxiety and negatively impact quality of life. Studies have shown that increased knowledge in ICD therapy among patients translates to better patient outcomes. There is also a lack of research focusing on improving patient education before patients receive an ICD. So what did I do? I designed a one-on-one nurse-led educational session that incorporated ICD topics that patients have identified as important and frequently missed by healthcare providers. The focus of my research is to determine the feasibility of delivering this education to patients before they receive their ICD. We found that we were successful in delivering this education to all participants within the study in an outpatient clinic setting in under 31 minutes. So now that we know that it's feasible to deliver this education before they receive the ICD, the next step is to determine the effectiveness of this education on patient-reported outcomes. With healthcare budget cuts limiting face-to-face time between patients and healthcare providers, and the number of ICD implants expected to increase annually, my research highlights a simple solution that has the potential to take the shock out of shock therapy.